looking at the x-rays and hearing that verbiage over the past month or so that I did the course for the MSK, I believe will be enormous to my practice when I do clinicals in February.
My name is Ram Srinivasan. I'm a director at RadClerk, and I'm here with one of our recent alumni, Robin Komay, an NP student. Robin, thank you so much for joining us today.
Hi, hello. Yes, thank you so much for having me. I appreciate it. I'm in my final stretch here. It was a 3-year program, full time. Started in May and went straight through summer and the spring. So this will be my 3rd year that I'll be finishing. I have been a registered nurse for 19 years, and I work in a small local facility, hospital in the day surgery setting, and just decided that I wanted a little bit more and wanted to jump into helping patients a little bit more at a deeper level. And so I started the program, but I've been a nurse for quite a while. So that experience has been extremely helpful in the nurse practitioner program.
So now you got a chance to work with RadClerk, both on the didactic experience in chest and then also subsequently in full certificate programs in MSK. Is that correct?
That is correct, yes. So for the tail end of our summer courses, we did chest readings. I really had never really looked at much for x-rays, so that was just kind of eye-opening. And I am going to be doing an orthopedic rotation in February for 120 hours for my schooling. And I thought it would behoove me to look at the musculoskeletal portion of things. And it was pretty amazing. I found myself you kind of get more eager to just want to keep doing it and be a little detective. The teaching and the explanation behind things was very good. And starting out from a beginner's aspect, I think it was very good. It was excellent to have to look at things and, look at the details, and it was very realistic.
Now I want to get to the juicy part of this. I talk to NP faculty around the country. I'm actually a member of the NOMPF, the National Society for Nurse Practitioner Educators. Thinking more broadly about all of your classmates around the country, what are your thoughts on whether radiology education even belongs in the NP student curriculum?
If you're going to go for a family nurse practitioner, you're definitely going to be in the setting where you're going to have x-rays. You're going to have kiddos that come in that have x-rays of their wrists and their ankles and the pneumonias and all the things. And if you can get that patient on antibiotics, if they have pneumonia sooner rather than later, or potentially get them to an orthopedic surgeon if there's a break or fracture that you see, then that's better patient care. So I think while it might not be used in every single setting, I think it's definitely beneficial. And just to even touch on just the bare bones, no pun intended.
Unintended.
Just a little bit.
Robin, thank you so much. And you're graduating in May. So
I am done in May.
Congratulations on what was undoubtedly an effortful but rewarding 3 years with your doctorate.
I appreciate it. And thank you so much for having me today. I appreciate it.